Hi everyone, and thank you all for us today. It's just gone 1 o'clock, so while I explain what we're going to be doing today, hopefully more people will be joining us. But I'm Emily, I'm the content manager here at Birdie, and I'll be your host for today's webinar session. And first of all, I'd just like to say thank you everyone that's joined for joining us on what looks to be a very, very hot Friday. If you haven't joined me before, a huge welcome and thank you for spending your lunch with me and my guests, who I will get to in just a moment. If you have joined me before, welcome back. You'll see that I'm actually in a different location to my usual one, as I'm back at Birdie HQ today, which is a lovely change of scenery, and it has aircon, which is great. Now, one point to make, my internet hasn't been the most reliable, but hopefully I'll be here throughout the entire webinar. If I drop off, don't worry, I'll be coming straight back. So what I'd like to say first is, can you all hear me okay? And if you can, just pop a note into the chat box. I can see that a few of you are already saying hello, so that's great. It's great to have you here. Now, if you can hear me, yeah, just let me know. It's a bit like talking into the void during these webinars, so if I know you guys are listening, it does make me feel better as well. But if you can all hear me okay, great. Now I'm just going to ask my guests to say hey. Now I do have 3 guests here. We have Malte, whose camera is off, but he is here too. So in this order, can I just ask Josie, then Malte, then Amit to say hi. So go.
Hi.
Hi. Hi.
Voice here. I'd also like to point out that Emily is not allowing me to put on the camera as a presenter because there's a maximum of 3. It's not because I'm trying to hide something from you guys. Full transparency.
Perfect, thanks guys. Simon, okay, is having some troubles. I'll get to you in 1 second, Simon. I will just say if I'm a bit echoey or if you hear some drilling or sirens, our HQ is based in Angel, and they're forever building something or whizzing sirens past on a main road. So if it does get a bit loud, I'll hop onto mute and hopefully that should get rid of any problems. Now don't worry, I will let my guests introduce themselves in just a moment, and I'll stop talking, and at that point, Simon, I will help. 2 seconds. Perfect. Now I know you're not here to listen to me today, so I'm just going to run through very quickly what we can expect from today and why we're doing this, and then I will let my guests introduce themselves. So perfect. The theme of this webinar today is all about preparing for a COVID-19 second wave. Now I know that's not something that we want to think about, and we're all hoping that it doesn't happen, but for those who provide care, those we care for are among some of the most vulnerable to the virus. So recent World Health Organization information is surfacing that says, we're actually moving away from this term of a second wave and moving away from the idea of seasonal thinking, because it's very clear this virus isn't going anywhere. So whilst we have labelled this as a second wave, I think it's more about future-proofing your business to make sure that you can cope with what's going to be coming. Now, this morning I was just checking out some of the latest guidance around this, and there was a really, really great quote here from Margaret Harris, who is World Health Organization spokesperson, and she told a virtual briefing in Geneva, it's going to be one big wave. It's going to go up and down a bit, and the best thing to do is to flatten it and turn it to something just lapping at your feet. So whilst I've said before, we did call this a second wave webinar, the point is here, we're talking about how we can indeed ensure that we all do our best to keep the virus at bay for the most vulnerable in our societies. Now, on screen, you can see the outline for today, and our panelists are going to be talking about the practical things that you can do now to stop the spread, some of the learnings, and what's next for care at home. I'll break the session into 3 parts, and I'll be speaking to each guest in turn, and then at the end we'll open up for your questions. Now, we do have a hard stop at 1:55, so I really, really encourage you to ask all your questions as we go along, and we'll get to them at the end in the Q&A. And if we can't get to your question, then I will follow up with the speakers and with you afterwards to try and get that answered for you. So that was a lot of words from me. So please, first of all, let me introduce you to my first guest, who is Josie Winter from Advanced Clinical Solutions. Now, she's an expert in infection prevention and control, and well, I will let her introduce herself.
Oh, thank you. So yes, I'm Josie from Advanced Clinical Solutions. My background is in theatre nursing, so I've got a real acute understanding of that surgical side of infection control. But I also have a master's in infection prevention and control, and I currently sit on the scientific advisory board for the British Institute of Cleaning Science. Who knew there was such a thing? Thank you.
That's great. Thank you so much, Josie. If anyone has any questions as well for our specific guests, please do make a note of that in the chat box so I can direct the questions accordingly. Now, second of all, really excited to introduce you to Amit, who is currently working with the NHS, but he has a whole has a whole host of experience in the health field, which I'll let him explain a little bit now. So Amit, can you please give our audience a quick intro?
Thanks, Al. Yeah, nice to meet you all virtually. So I have worked in healthcare pretty much my whole career. So first as a civil servant, working with the Department of Health, then as an NHS manager in Chelsea Westminster Hospital. And then I launched an online doctor service called Zava, which myself and a co-founder ran for the best part of the last 10 years. And as Al said, recently joined NHSX to work with them on some of the new work coming out of the initial COVID crisis. And because it's relevant to the conversation later, I'm also on the board of the London Ambulance Service. So I'm a non-executive there, and obviously the London Ambulance Service was at the sharp end of the initial COVID crisis. So I think when I talk, it's probably good to say that I'm talking in a personal capacity and drawing on both NHSX and London Ambulance Service experience.
That's great, thanks, Amit. I think that's going to be super, super interesting a bit later when we get there too. Now, finally, my third guest who you can't see, which is my fault entirely. Malte, could you just please give us a quick intro? Over to you.
Picture there of me in a suit, and I can assure you I'm not sitting here in a suit in the scorching weather today. So I'm Birdie's Chief Integrated Care Officer, and I lead on our work together with our partner agencies of how we can provide support and benefit not just to home care specifically, but also other parts of the health and social care system, both the NHS and local authorities. And before Birdie, I spent some time at the Care Quality Commission, so Josie and I already had a bit of a chat about the pros and cons of that before, and have worked abroad as well as in central government here in the UK.
Perfect, thanks, Malte. Now, I'm going to launch straight into the Q&A. I know we have Emma and Simon have a couple of sound issues, so I'll try and pick up on those while you guys are speaking. But I think it seems like, yeah, most other people can hear. If everyone else can hear okay, do please let me know in that chat box. But great. Okay, so as I mentioned before, I'm going to split this into 3 sections. And the first part of this webinar is I'm going to be speaking to Josie around the practical things that we can do around infection prevention and control. So Josie, the first question I have is, what is the importance of infection prevention and control in home care? I know there was some recent guidance released yesterday by the CQC for care homes, but of course, we work with domiciliary care providers as well. So if you could maybe explain a little bit around that, that would be really useful.
Yeah, absolutely. So it's probably useful to discuss about what infection control is and what it absolutely isn't. So there is this sort of preconceived idea that infection control is just a bit of training on PPE, flicking through a few slides on hand washing, maybe having a few policies in place. But it absolutely is so much more than that. So it's such an interesting area. So it's useful to probably take a bit more of a scientific and practical approach to it. So there's areas like microbiology, immunology, behavior change, technology, innovation. So all of these things can feed into infection control. So the ultimate aim is to keep a safe environment for our service users from infectious diseases. It sits well and truly in the safe domain of the regulators, and I think we need to start thinking a little bit outside of the box when it comes to infection control.
No, I think that's great, and I think what you touched on at the beginning is super important. COVID has really opened our eyes to what we need to be doing. And of course, we all want to stop, this happening again. And before, previously it might have just been a very, very quick training session, whereas now there is so much more that we need to consider. So what I wanted to pick up with you is I did hear a talk that you did recently, and you mentioned the chain of infection. And to me, this is really, really, really interesting. So could you just give us a quick overview of what the chain of infection is and what role this has to play in dom care, but in any setting of care?
Yeah, absolutely. You've got it right. So it's any setting, whether that's in someone's home, if it's in a care home, or if it's in an acute NHS hospital. So the chain of infection is it's useful to kind of think of it as like a bike chain. So in order for an infection to go round or a bike wheel to go round, these links in the bike chain need to be all together and sort of working in tandem. And it's absolutely the same with the chain of infection. Now, this is not new stuff. This is part of mandatory infection control training. Everybody should know about the chain of infection, but it's always good to get a bit of a refresher. So there are essentially 6 links in the chain of infection, and it always starts with the bug, the microorganism itself, right at the very top. That bug then needs somewhere to live, and we call that a reservoir or an environment. So it needs somewhere cozy to live. It needs to breathe, to eat, all of those sorts of things, just like we do. It also needs a way to come out of a human and a way to move around onto somebody else or into somebody else. So we call this the portal of exit and the mode of transmission. So we'll talk a bit more about the mode of transmission later, but that's sort of how it moves around. The next sort of link in the chain of infection is what we call the portal of entry. So how is that microorganism getting back into somebody else, into another person? And then finally, the last link in the chain of infection is what we call a susceptible host, or somebody who's vulnerable to infection, somebody who's got a compromised immune system. So when we think about infection control, we're really looking to see how we can break the links of the chains of transmission. So that's what infection control is.
No, that's great, and thank you for kind of running through that again. As you said, this should be something that dom care providers are aware of, but I think to take it in terms of the global pandemic, it's about where can we have an impact to break that chain. Now, if everything is going through the chain as normal, of course we're going to spread the disease, much faster, or spread the virus faster than we would like to. But if we can step in and at least make one of those things broken, then we limit the capacity for this virus to spread, and that's what we're talking about here with a second wave, or maybe not a second wave, maybe a continued wave, or whatever we want to call it. The idea is to reduce the ability for it to spread, and in home care, it's really, really important, especially when you have a member of the care team who's visiting multiple people. They need to be aware of their own kind of chains and what they can do in that. Now, the next question I have for you, Josie, is around now we're aware of this situation and we know what we need to do, but where can home care providers find information, and how can they be compliant with that information? The guidance is changing all the time. I just mentioned at the beginning of this webinar that new guidance was released yesterday.
Yeah, absolutely. And you know what, before I come and do any of these types of talks, I always do a bit of, I tend to follow the science. So I went and did a Google Scholar, a PubMed search around papers that have been released around infection control in home care. So have a guess at how many I could find specifically for home care around infection control over the last year.
I imagine there was very, very little, probably nothing.
There were less than 5 across the world, less than 5, which is absolutely ridiculous. This sector is just not getting the attention it deserves when it comes to papers and case studies and evidence. But there's lots of generic evidence out there and guidance. So I would be looking at NICE guidelines. I'd be looking at the NHS. I'd be looking at Public Health England. The NHS have some good information as well. But specifically to home care, not a lot.
Which is such a shame. And, like I mentioned, the guidance that was released yesterday, that was for care homes. And it always seems that domiciliary care is almost left behind in this guidance. And the initial PPE guidance that was released back at the beginning of the COVID crisis, it wasn't tailored for home care at all. And I think it's kind of a difficult space to play in, because you can follow the generic guidance, but of course, when it comes to CQC and those kinds of things as well, you want to show that you're adhering to the right guidance. And quite often it's up to home care providers to kind of make their own decisions based on the mass of other information that's there. And that was a huge problem that we found at the very beginning of COVID, helping our home care providers to navigate the pure amount of information and take what was relevant. So moving on from that kind of idea, Josie, what would you suggest for a dom care agency who is looking to put some kind of a framework in place? What should they be doing to build on what they've found?
Yeah, this is really difficult. As you say, the guidance isn't out there. This sector is almost I hate to say it, but almost an afterthought. But let's think about this pragmatically. There is going to be a massive focus on infection control from the regulators. It's not going away, and it is not going to go away in the next 6 months. So we need to be building long-term strategies. The sector as a whole is changing. So we're sort of moving from this task-based commissioning to quality-based commissioning. We're seeing lots of integrated health and social care models, like for the Vanguard sites, for examples. We're seeing lots of new nurse-led home care models as well, and extra care. So, there's got to be a level up of the standards somewhere across the board. We have to be striving to level up knowledge and skills in infection control. We're seeing more and more invasive clinical work coming in as well. So, it's now. We need to be thinking about this now, not in sort of a few months' time. It's here right now.
I think what's really important about what you just said, Josie, is that it is here and it is now, but given the lack of guidance, it might be something that home care providers, perhaps, like you said, first of all, don't really look into as something that needs to be done. Whereas if we take these proactive steps now, if we start to look at this, that's how we as home care providers play our part in reducing the spread and breaking that chain of infection by making sure we're adhering to the right things in infection protection, prevention and control. It's not going to happen in a day. It's probably it's not even going to happen in the next couple of weeks, but we just need to kind of start now. And in doing so, I think home care providers everywhere could really benefit in providing safer care. And you mentioned a few things as well with quality-based commissioning and that kind of area. And things are changing in our industry, and they're changing for the better as a result of COVID. And I'm sure that Amit will speak to us in a moment about other learnings in this field. But we are in a period of change, and I think what we need to figure out is the best things we can do now. And infection prevention and control is something that we can do now. And it will have a positive impact. But the last question I do have here for you, Josie, is how can we play our part in reducing the possibility of the second wave, and what's next for home care? Well, for everyone, I suppose, when it comes to this.
Yeah, I completely agree with you. Let's move away from this second wave. I don't think it's going to be a second wave. It's going to be more localized spikes, and this is not new in infectious diseases. I think we need to be thinking about what a really robust infection control framework looks like in home care. And it's not easy. The accountabilities are often confused around simple things like who is responsible for cleaning care equipment, who is responsible for waste disposal. All of those little strategies that we have in our arsenal for infection control it's a little bit blurred. So I think it's getting absolute clarity. Get your game plan straight. What are your strategies to break the chain of infection? Sounds simple, but not always.
No, definitely not. And it is a case of taking a look at your processes and seeing what you can do. And there's just a message here from Samantha who says, why does dom care always get forgotten? The focus is always in care homes. And that's something that really rings true, you know. I don't know what you think about that from your point of view.
You know, when they released the announcement around the £600 million infection control fund, where were home care in that? Where were they? Not even mentioned.
And it's something that, you know, we acutely feel here at Birdie, obviously working with domiciliary care providers, and we're hearing constantly, you know, recently given the COVID outbreak, that the future of care is at home. So where is the support for that? And I mean, I wish that I had a magic wand and could say it's here, but, you know, I don't. And the only thing that we can do now is like these webinar sessions, you know, we want to open that conversation and help where possible. But yeah, Samantha, we're all in agreement on that point there.
Yeah.
Right. Now, I'm just going to switch on over here, change the slide, and I'd like to speak to Amit now about some of the learnings that you have had, you know, in your own kind of experience with COVID. And I know, you know, you mentioned that you're working with the NHS, but you have some other learnings from the London Ambulance Service, which would be great to talk about. But the first question I have is, you know, with your work with the NHS during COVID. Now, what was put in place by the teams there during COVID-19 initially?
Yeah, thanks, Al. So, so for those of you who don't know, NHSX is an organisation that is focused on the technology side of both health and care. So its kind of mission is digital transformation of health and care. So it covers everything, even though it's badged as NHSX. I think in terms of the initial crisis and the response, I think there were a number of things done. A lot happened, as a lot happened across the health and care sector in general. Examples of those, there was quite a lot of patient-facing things done. So there was a lot put onto NHS 111 to have the online version of our 111, you know, putting on high-quality information around COVID, creation of a digital triage tool, and actually I saw the benefit of that from the London Ambulance side. So with my other hat on, because the London Ambulance Service runs some of the 111 call centres in London. And the volumes of calls just went almost tenfold during the height of the crisis. And it would have been a lot more if there weren't digital resources in place that people could go to and get information on what are the symptoms, how do I, what do I do next, etc. So there were some tools put in place to support people. There was a lot of tools put in place to support care professionals, so health and social care professionals. There's probably a slight bias or a slight slant towards some of the NHS tools, but when people started to go into lockdown, there was a need to be able to do a lot remotely. So a lot was done to make sure that people could still be treated and seen and listened to and have check-ins via remote tools. So, for instance, every primary care practice in the country was given video consultation tools. At speed. So some of them had them already, but within a few weeks, pretty much everyone across the country, every GP had access to a video consultation tool and to software they could put on their website, practice website, that would help to triage people who had COVID concerns. The same was done with secondary care. So for doctors in the hospitals and nurses in hospitals, they made available video consultation tools. But again, those health issues could still be picked up and addressed, even though the country was in lockdown. And then there was quite a lot done around connecting up health and care. So NHS Mail as a secure communication route was rolled out across as much of not just the NHS, but of the care settings as possible. So some of the listeners may well have been involved in introducing NHS Mail within their own organisations. There was the digital social care website was set up was kind of given some support so that it could deal with technical issues around things like getting set up on NHS Mail. And for care staff in general, health and care staff, Microsoft Teams as a sort of communication platform was put in place so that people could still keep in touch with each other. And finally, I think as part of that, there was quite a lot done around connectivity, more, to be fair, actually in care homes. So I think a realization that in some care homes there wasn't the Wi-Fi capacity, there wasn't broadband capacity, there wasn't the physical digital device capacity to be able to do video consultations, to use NHS Mail, to be able to use tools that would help report on how things were going around the COVID crisis. So there's quite a lot done to sort of get people broadband, get people connectivity, to get devices into care homes in particular to deal with that initial phase. So yeah, that's definitely not an exhaustive list. There was a lot done, but that's probably some of the highlights. In terms of lessons learned, I think there were a few. I think that one was this issue around connectivity and around basic digital infrastructure. So having access to broadband, Wi-Fi, and having devices where that was in place, that was definitely helpful. So if I take an example from London Ambulance Service, they were able to, because most of their infrastructure, a lot of it was digital, they were able to expand their call handling capacity for emergency calls, so 999, very quickly. So it took a little while to start up, but they were able to effectively get a whole new call center staffed by paramedic students who were specifically triaging emergency calls related to COVID. And to do that, they needed, they were able to do that because the telephony system was digital, the care records was digital, and they also had to do quite a lot to sort of do a very, very shortened training course. So the training course for someone to handle 999 calls is normally 3 months of training. They were giving people 3 days of training to be able to specifically deal with COVID, because they needed to get the workforce in, because quite a few staff within the ambulance service were going off sick. So I think in terms of lessons learned, one was when something like this happens, it impacts on your staff, and you need to be able to deal with that. Second was that the digital infrastructure where it was in place was helpful because it gave people flexibility, but you needed support. You also need to be flexible around things like training and how you got people in place. I think third lesson was probably there are just areas that have basic gaps in some of this digital infrastructure. And I do mean things like, this will be people's homes as well, where they don't have broadband, they don't have Wi-Fi, they don't have any digital devices. So when you then start saying we're in lockdown, and how do people stay in touch with not just care and social health and care providers, but with their friends, with their family, how's that all happen when you've locked everything down? It was much harder in those, in people's homes where there wasn't connectivity. It was much harder in care settings where there wasn't that connectivity. So I think that was also one of the things that was learned from this.
I think to just draw on something you said there, the London Ambulance Service was able to respond so quickly because they had this digital infrastructure in place already, and it allowed them to kind of grow. And like you said, they built this call center. Like, it took a little bit of time, but it was there. And the difficulty with domiciliary care is that there is not that digital infrastructure in place yet. And I know Malte will talk to a little bit about the kind of the future of care at home and what that looks like from a digital a digital point of view. But also to go back to what Josie said initially, if you're looking at this kind of chain of infection or whatever, and the ways that you can slot into that, I think digital fits in very, very nicely. And to see the ways that this has worked across the board, with the London Ambulance Service, for example, and the way that that helped reduce the 999 calls and help with the faster triaging, to bring this and put this into a dom care setting, I think the two just work together, unbelievably well. And I mean, of course, we would say that from Birdie's point of view, we'd love everyone to be digital. But I think just to listen to those lessons that you were saying, it's never been more clear that this is the way we have to do things now. And being able to kind of, I suppose, what really resonated with me just there is what you were saying about triaging. And it really helps down the line, I suppose the care pathway to kind of shorten that and make it digital in the very first place, and then to have all the records digitalized, it just brings everything together. Now, I think you covered off really well some of the main lessons in this space, but what I would like to ask is from your point of view, do you think that kind of digitalization could be achieved in the social care setting?
So I should preface with two things. One is that I work for NHSX, which is the digital arm of the NHS, and I started a health tech company. So I'm a bit of a tech geek. So my bias is probably always going to be somewhat towards technology and digital and what it can do. But I think that, and I'm not an expert in the domiciliary care setting. So you'll have to, the people listening to this will probably have a clearer insight onto that than me. But I think in terms of what I've seen so far, not just at London Ambulance Service, but within the NHS, within NHSX and the company I started, if you've got some of these basic digital things in place, it gives you more flexibility, which is, I think, very relevant to COVID. So it doesn't solve problems in and of itself. So, there were problems around getting protective equipment to people, the PPE issues, in health and care. Digital didn't give a silver bullet to that, but where we had infrastructure and where we had the digital infrastructure around connectivity and devices and agreements around, some of the basic logins and governance, it just created flexibility. So again, from my London Ambulance Service perspective, everyone was, all of the managers, etc., were able to carry on working from home pretty quickly because they all had laptops and they could all, and they had to go and solve some people's Wi-Fi problems at home. But actually, a lot of the support services like finance and HR and logistics, etc., were able to continue working because they had that core infrastructure. So I think that it's not that digital is in and of itself going to solve everything, but it does definitely give you, I think, that flexibility that you can, your staff are able to continue to work remotely. You can bring new staff in who might be not located in your geographic area. You can stay connected via tools like this that we're using now around, video consultations, which I think is important around checking in on people's status, both in health and care. So I would say that it's extremely important in terms of the digitization of the care. The agenda around this in care is important, and I think you've seen that from Secretary of State Matt Hancock has talked about this. That that he sees that things have been accelerated by the COVID pandemic, that were already being planned, and that's going to continue to be the case. That we're going to continue to bring in more digital pathways and more ways of treating people remotely, both in health and care. And I think that's the expectation. Challenges, how do you do it, and how quickly can we do it?
Yeah, I mean, for sure, it's about trying to get this in place as soon as possible. And just, one thing you said there as well about the team being able to work remotely, that's something that's, absolutely crucial for many businesses. COVID kind of shined a light on the importance of that. And to be able to bring that flexibility into the care sector would just be brilliant. And I think this ties in really, really nicely with what Malte is about to share with us. So I'm just going to change this slide over and bring Malte into the fold, even though you can't see him, he's here, I promise. So Malte, can you kind of talk a little bit about, given the COVID-19 crisis and the possibility of, well, I'm going to say a second wave, but, the fact that it's ongoing, what do you think is next for care at home, given what Josie's just said and what Ahmed said as well?
Yeah, thank you. Thank you, Al. So I think from the contributions we've heard from Josie and Ahmed, there's sort of this, two things that stand out for that. I think the first is that home care remains essential for us to become resilient in our health and care system. And as much as it hasn't received the attention it could have done over the last month, we know that that's where people prefer to be, in their own homes. And also, if we want to keep people out of hospitals and out of residential care, then home care becomes the place where improvements can make the biggest difference in terms of protecting people. But I think it's not just that, it's also that digital technology can help, and can help relatively quickly. And that's the first point I wanted to make, because as Ahmed alluded to, there's clearly several efforts now at national level going on that I think over the next year or so will change the way in which home care is being looked at and is being considered as part of the wider health and social care ecosystem. NHSX is looking at social care much more closely. We know that primary care networks have been set up over the last few months and are focusing a lot on care homes, but the next step for them is to also think about what it means to manage their populations properly and identify risk. And there, the insight from home care are going to become invaluable. And we've had lots of conversations with GP practices and primary care networks about that sort of information. Now, I think the point is that those national efforts, as welcome as they are, they will also take some time. They're not going to change things overnight. They're not going to change priorities overnight. So it will not feel like a big shift immediately, I think, for our home care agencies in the country. So the question for me then becomes, what is it that can be done at the local level and can be done relatively quickly that can make a difference? And I actually believe that there isn't a huge technological jump needed to make a difference somewhat more quickly, because I believe a lot of the difference that we've seen in other sector, the changes in other sectors that made a difference around COVID have come from the opportunity to communicate better and collaborate better across teams. And those of you in the webinar who are already using the Birdie platform, for example, you will know that you can already give third parties access to some of that information, such as GPs, such as community nurses, and others. So I think there's an opportunity now to think about who are your local GPs, who are your health community teams, who are maybe some of the bigger voluntary organizations in your area that you're interacting with more regularly in any case, and what sort of ways of working and communicating could you put in place now for potential second wave, or the continuation of that first wave, and it doesn't need much more than what we have today. Yes, it's a bit clunky. We call it hacky here in tech world, but it actually works, and it's worth exploring, because quite often, and again from our conversations, people will just not be aware that some of that data sharing is possible, and some of those conversations and communications are possible, but it won't happen by itself. It will require local effort, and that's of course then means work for you guys and effort for you guys. The second main point I wanted to make is to look a little bit ahead, and I think what's the opportunity here through digital platforms, because once the way that care is managed in people's homes and home care is available digitally, it just enables so many more different ways of working, and these are different ways of working that aren't just to the benefit of the care recipients, the service users. They're also to the benefit of your care workers, because it's an opportunity for them to contribute to the well-being and independence of the people you look after in different ways, and I believe more empowering ways as well. So a few examples of the sort of thing that we're currently exploring at Birdie with some of our partner agencies and organizations in the NHS about what could be done. More specifically around COVID-19, how can information more quickly be shared from home care agencies into other parts of the local area? That's not just something that we're looking at; it's also being looked at more nationally through CQC and otherwise. But once this information is recorded in a digital platform, you can share it easily. Secondly, I already mentioned around primary care, a lot of GPs are now interested in how they can identify and engage with those people on their register in their local area who they deem at risk of for example, being admitted to hospital or having long-term health conditions. And often you guys will hold really important information that the GP has never seen. And that conversation has just never taken place. And as I said, a digital platform can help sharing that information, but actually you don't really need the platform to begin with just to start that conversation. There's also examples of where health and care pathways are, I think, coming together increasingly. So for example, when patients are being discharged from their hospital, many home care agencies support people on discharge home to assess pathways or reablement pathways. And often the insights and the observations from the care worker going into the home every single day, often more than once a day, is way more regular and valuable than that of the NHS professional. A physiotherapist might go into the home once a week, maybe twice a week. And actually bringing both of those sites and observations together will give a much richer picture and better understanding of where people are at risk and helping them to not get readmitted to hospital. This is one conversation we're having with the community trust here at Birdie. But I think it's not just about the way care is being delivered and information is being shared. I think it also means that in the future we can think about the way that services are being commissioned. Simply having information about care at your fingertips means that you can share it with your councils in different ways. whether that's the social workers in terms of changes to care packages, or whether that's in evidencing how the goals and outcomes as part of care packages have been achieved. And here at Birdie, we're currently thinking about how we can bring outcome measures into our platform, both in terms of objective metrics of well-being and independence, but also to begin to record goals for care recipients on the platform and to what extent they're being met. So, for example, if someone one of the goals for someone is that they can dress themselves again, that can be recorded and tracked through a platform, and that can generate a different conversation between you and councils on and how care is being commissioned. So I think there's exciting opportunities here for the sector, and I think that these are exciting opportunities that we don't just have to rely on national efforts on. Of course, they're important; they will set the framework and they can accelerate and kickstart things, but actually, through collaborating and co-designing some of those opportunities locally, and this is the work we're trying to do at the moment with some of our partner agencies and NHS and local authorities, I think we can identify potential solutions that might indeed be much more fitting than what can be done at the national level. Having worked at the Department of Health myself and at the regulator CQC, it can be very difficult to design solutions that work for every locality. It can be much easier to set a national framework, and I think the two need to come together, and the opportunity is there. So we from Birdie would love to continue to work together, I think, with all of you, and develop these relationships locally between different organizations to explore how we can contribute to that change in which home care is being provided.
No, that's great. Thank you, Malte, for running us through that. And I think some of the important things that you just said there that I'd just like to pick up on were, the ability for care workers they know more about what's going on. They might visit people 3 times a day. And it's about, especially given that, we're facing more, a second wave of COVID, and it's a situation where we're just not entirely sure how it's going to pan out. Whereas these care workers, who are visiting people every day, they have such an insight into these people's lives. And not just from a COVID point of view, but from a general well-being point of view. They have the ability to sort of be the missing piece in the puzzle, I suppose, which is really great to hear. And, the way that Birdie is working towards that, I think is just one step in, a whole national framework for this. But I just want to quickly head over to the Q&A. And just see what people have been asking. So we've only got about 10 minutes left. So if anyone does have any questions, please do pop them into there. Now let's have a look. Could you give an example of an integrated digital platform? Malte, that's probably one for you.
An integrated digital platform that links home care together with other parts of health and social care, then I'm afraid I can't, because they don't really exist yet, and it's obviously something that we're trying to achieve. But there are now examples in the country where organizations have brought together the records of acute care, urgent care, and also social care. Torbay is one example where actually the local authority and the NHS commissioners have come together and started to share information in that way. It is worth saying the emphasis here is on local authority rather than social care providers, because I think one of the challenges we still have is that there's so many different social care providers, both on the care home side and the home care side, that usually this conversation starts with the local authorities and, for example, what care packages they commission as part of the information. That is very different from having real and genuine care information about individuals. So a local authority will usually have information about the care package that they've commissioned and the assessment that they have made. They do not have the information about the actual care that's being delivered day to day. And actually what we're after is to bring together the insights of the care that has been delivered day to day, and that is the information that you guys have. And that, for me, is not a connection that has been made so far into home care, and is one I'm super excited about seeing, hopefully with our input at some point over the next 12 months.
Thanks, Malte. That was great. We just have another question that's just come in. What is your opinion about IoT devices being intrusive in the lives of patients in domiciliary care?
Whom are you directing this one out?
Sorry, Malte, what did you say?
Shall I have a go at this?
Give it a go.
Yeah, I'll have a go at this one. So I think that the most important thing to say is that IoT devices only work with the consent of the individual, right? That has to be the basic principle that the service user, the care recipient, the individual is happy to have these devices installed for that. Secondly, I think just as important a principle is that the way this information is being shared is safe and in line with all the relevant regulations and legislation as part of that. Personally, I must admit, I've come across the question, but in the pilots that Birdie is running, for example, at the moment, with a care agency and a council to use home sensors alongside our Birdie platform. I think there's one care recipient who preferred not to have the sensors installed, and that's okay, but the vast majority were happy with that. Ultimately, I think it's in any other area where the sharing of patient and health and personal information is involved, if we can make clear enough the benefit of why the information is being collected and who is being shared with, then most people are happy with that to happen. It's only if we talk about collecting information and we can't explain why, what it is for, and how it can be a personal benefit, then I think it becomes very, very difficult. So I think it's an important question, but I think it's one that can be answered in the affirmative if it's done the right way.
Yeah, agreed on that one. Thanks, Malte. And I think we talk about technology and the ability for digitalisation to kind of open up so many new opportunities, but it's it would be a change in that. Yeah, we need to make sure that we are aligned with what the client or the person that's using the service wants, and it's not to be intrusive, it's to help. And maybe there is some work that's done on that. And as Josie mentioned, there's a lack of case studies and stuff that's going on in home care in particular that would support this and I suppose help. Now, there's no more questions that have come in. If anyone else has a question, please do feel free to ask it very quickly. But I have a question that I got from an agency that we're working with for Josie. Now, this is about digitalisation and infection prevention and control together. Now, the question was, if you're encouraging your care staff to use digital devices in a client's home, how do we tailor that into our strategy for infection prevention? If they're using these devices all day, every day, touching them, and there's not really any clear guidance for mobile phone usage. I had a look this morning and there's very, very little that's been written about that. So what's your opinion on that?
Okay, so this kind of comes back to good sort of cleaning and disinfection practices, doesn't it? So our phones are things that we are touching constantly, all day, every day. I don't know whether there's been a study done around how long they survive on phone screens. But yeah, I think it's just with anything with infection control, the idea is to reduce the amount of pathogen to an acceptable level. So it's simple, it's a high touch area, regular cleaning and disinfection if you can. But on the flip side of that, I'm very, very interested in looking at technology or something that can almost sort of put join those dots together. So somebody's got a spike temperature or somebody is not quite feeling themselves. Who is there putting the dots together, joining the dots together? And I think that's definitely interested in seeing how that develops.
No, for sure, and thank you for covering that off with the mobile phones and that aspect of it. Hopefully that will answer the question that came in to me. And yeah, I think there's a whole lot more we can discuss about how we align, all of the things we've been talking about today into a more kind of integrated way of working. Now, I just want to double check. I don't think any more questions have come in. I don't know if you guys had any further points. Sorry, Amit, you're about to say something.
Just following up on the last point you made, Al. So the piece of work that I'm actually leading within NHSX right now is actually looking at starting from a household perspective and looking at what are the different sorts of digital interventions that are happening or likely to happen going forwards across health and care. So I saw in the comments that Roger Bayliss had made some comments around some of the interoperability issues. But if anyone's got views on this or is working, has done interesting work in connecting up between sort of health and care side via digital, or has some views on the barriers they're facing, then I put my email address in the chat. I'm happy for people to drop me a line, because it's top of mind right now, and I had a conversation with Malte about this just a week or two ago. So that's sort of how do we join this up from the perspective of individuals across healthcare within the household is something I'm keen to talk about.
No, for sure, and that's something that Malte mentioned as well, and I think it's about opening this conversation. So your email address is in here, and I can share that with anyone who wants that. Feel free to get in touch with me as well, and I can help point you in the right direction. Josie's also popped her email address there if you have any further questions about infection prevention and control. Now, I know it's a huge subject, but I'm sure that Josie would be more than happy to kind of explain anything in further detail if you need that. Now, great, I think that's everything there. Couple solutions. Let me just double check. Cool, okay. Yes, okay. I think Malte will follow up with you, Roger, and I think Amit will as well. I think there were some really interesting points raised there. I love to see interesting points in the chat box as well. It also says that you're listening, which is great. Which, as I mentioned before, it's a bit like speaking into the void. Now, if you want any more information on Birdie, of course, there is some information there, and I will send a recording of this webinar to everyone that attended today and share any useful links that we discussed, plus the email addresses too. And that is it from me. I will give you back the last 10 minutes of your lunch hour. And just want to say a massive thank you to all of my guests for joining, to Amit, to Josie, to Malte, even though we couldn't see your face. It was lovely to have you here, and thank you so much for all of your feedback and all of your insights and expertise into this topic. It's such a wide, and there's so many different angles we could take, and I'm sure we could sit here and discuss this for hours and hours and hours. But I do hope that this was useful to everyone. And if you have further questions, don't hesitate to send me an email or reply back to the follow-up email that I'll send you straight after this with the webinar. And yeah, I hope this is the beginning of many conversations that we can have. So thanks very much, everyone. And yeah, thank you guys for joining us. I will log us all off now. And yes, I will send my recording.
Thank you.
Thank you.
Thank you, everyone, for joining.